So the pain after a tummy tuck is a lot better today than it was just a few years ago because we now are using a nerve block with a product that helps prevent pain for about 3 days. Now the first 3 days are the most intense portion of your recovery. So by being able to block the nerves that cause pain or that give you the sensation of pain from the abdominal wall, it's really been a game changer. And nowadays patients complain when I speak to them the next day that they feel tight, they've got some tightness, but they don't really have all that much pain. I beg my patients to wait at least a year before getting a tattoo over their tummy tuck scar because you really don't know what you're going to get. It takes a good 8 or 9 months for that scar to begin to mature, and it really does get better and better as time goes by. So if one jumps the gun and gets a tattoo 3 or 4 months after a tummy tuck, you know, the tattoo is going to last a lifetime. That scar might fade, and many times it really becomes kind of a nothing burger at the end of it. So the average person doesn't lose very much weight with a tummy tuck. You know, it's really impressive. Fat floats in water for a reason. It's actually very light. And I will tell you that when I do body contouring procedures, like a body lift or a tummy tuck for a massive weight loss person, and I take very large sheets of tissue off of the patient, we weigh them before we send them down to pathology sometimes, and they don't weigh very much at all. I would guess that the average person might lose about 3 pounds after a tummy tuck, if that. The truth is that because fat doesn't weigh very much, it means that when I gain 10 pounds, it's a lot. It's a lot of volume that it takes up on our body, which is a little bit depressing to think about. So the question is, do we ask patients to lose weight before a tummy tuck? And the truth is that we want you to be euthermic. We want you to have a stable weight at the time of the operation so that we know what we're making when we're making it. I'm not sure if that makes sense to a lot of folks. Now, there are people whose body mass index is simply too high, and we would rather not perform a tummy tuck for those folks until they lose weight. But even for those folks, after they've lost the weight, we want them to be steady, because if you go through a yo-yo phase after the fact, your results are going to vary, and we really can't be sure what you're going to end up looking like. So a keloid is it's a tough problem to have, and I certainly would want to examine anyone who said they had a keloid preoperatively for a tummy tuck. That word keloid, quote unquote keloid, gets thrown around a lot by folks who don't quite understand what a keloid is. If it's a real keloid, I probably would rather not operate at all. If it's a hypertrophic scar, meaning just a scar you're not proud of, I might consider doing the procedure and inject a very low dose of steroid along the incision at the time of closure. And you know, again, for some folks, they just think that a bad scar means it's a keloid. And the real key with tummy tucks is putting the scar in a place that it can be covered by a bathing suit. It's something that I consider to be one of my strong points. I pretty much can put the scar where patients want it to be to wear any given fashion. So adhesions is basically scar tissue inside a body cavity. After a cesarean section, it certainly is possible to create adhesions between the organs. During a tummy tuck, we don't enter the belly. We don't go inside any body cavities at all. The entire operation is only skin deep. Well, skin isn't that deep, right? It goes down about that much, depending. And we have basically zero concern for adhesions. Now, that being said, it would be a shame if we did a nice, beautiful tummy tuck that we're proud of, and then later on you needed another operation because of your adhesions. So I would like the adhesion situation to be stable before we went to the operating room for a tummy tuck. But in its essence, no, one has nothing to do with the other. Tummy tuck and a BBL can be done at the same time. I don't favor BBL operations, and I typically will send those patients out to have that work done. I have my own reasons for it. But no, the truth is, you can do them together. Now, if you wanted to separate them, you can. I would guess something in the 3 to 4 month range between procedures is probably appropriate at a minimum. But there's really no harm in doing the two together. It is a lot of work, and I suppose the BBL doctor might say, you know, I'd rather you not sit on your booty after I put fat in it. So they may have their objections, which is why I would say you do the BBL first, and a few months later you have the tummy tuck. So I've had a number of patients come into town from other places. I've actually performed operations on folks from Australia. I actually, no kidding, I argued with this woman on the phone at one point and said to her, you know, you're literally going to pass every other plastic surgeon in the world to come here to New York to have this done. There's no reason for that. There's very good doctors that are much closer to you. I mean, it was flattering, but she came in. In these cases, we do ask folks to hang around at least 10 days or so because we want to make sure everything is kosher before you head back out. Yeah, it's New York, so it has to be kosher. Basically, I want to know that your wounds are healing well, there's no sign of infection, and there's no collection. The belly button looks healthy, all those kinds of things. So roughly 10 days, 2 weeks is better, but at least 10 days.